friends, welcome back to KimmyDTV, a place where nurses and aspiring nurses come to achieve academic and career and life success, okay? In this video, we're going to be going over how to interpret ABGs, or as they call it, arterial blood gas volumes, okay? So I remember having to solve these in my last quarter of nursing school, and it was kind of a little bit hard for me to grasp the concept. And you may encounter this in nursing school, you may encounter this when you're about to sit for your NCLEX, whatever it may be. I want you guys to be easily able to look at arterial blood gas value and for you guys to automatically be able to 1, 2, 3 just solve it without any difficulty, okay? So if you guys like this video, please give it a thumbs up, hit the subscribe button, hit the notification bell so that you never miss a video, okay? So without further ado, let's get started and solve these ABGs. All right, guys, so just to preface this video by saying we're not going to go into too deep into what exactly is the conditions that can be affected by the variations of your arterial blood gases. For example, we're not going to go over the signs and symptoms of respiratory alkalosis, respiratory acidosis, metabolic acidosis, metabolic alkalosis, because this video will be too long. If you guys want me to make a separate video diving deeper into these illnesses, let me know and I will, okay? So the first thing I want you guys to do is actually take out a sheet of paper, because I'm going to be erasing the board as I go along, just because it's a lot of content and this board is not that big. So I want you to have a sheet of paper so that everything makes sense, okay? So ABGs stand for arterial blood gas volumes, okay? So I'm going to zoom on in so you guys can see a little better. Alright guys, so when solving ABGs, there are 4 components that are super duper important to know, okay? So one of them is pH, okay? Now these values that I'm writing down here, keep in mind that you are 9 times out of 10 are going to have to memorize it. My professor didn't provide us the value, so we just had to memorize it, but don't worry, once you do it over and over again, it's so easy to memorize. So the normal pH in your blood, 7.35 to 7.45. Okay. All right, guys. So the first component is pH. Anything that is below 7.35, the blood is going to be abnormally acidic, okay? Anything above 7.45, the blood is going to be abnormally alkaline, okay? So we want to make sure that the blood stays between 7.35 and 7.45, okay? This is how we say normal here, guys, okay? So the next component that I want you guys to write down and memorize is PaCO2. PaCO2, okay? So that is the amount of carbon dioxide, okay? Before I give you guys the normal values of PaCO2, I used to do these med-surg review live videos, and I brought up a term that I like to call matching, right? So there are certain things in nursing school that you have to know that they match, that they always go together. So if you see one, you'll see another. For example, you see salt, you think of pepper, okay? You think of rice, you see rice, you think of beans, for my Caribbean people out there, okay? Matching. So when you see PaCO2, so the whole point of matching terms is, even if you don't understand something 100% because you have a lot of classes and you're just trying to like pass this test so you could go on and move forward, and maybe it's taking you a long time to understand it, I like to use a term called matching, and that's what I did when I was in nursing school, and there you go, I was very, very successful in nursing school, okay? Think of PaCO2, I want you to think about acid and the lungs, okay? So I want you to think acid and lungs, okay? So these go together, okay? So when you think of PaCO2, I want you to think about acid being acid, and I want you to think about the lungs, okay? So PaCO2 is basically carbon dioxide, okay, in the lungs. So I'm going to give you guys the normal values, of course. Normal values of PaCO2 is 35 to 45. And what do you know? It matches the pH, 7.35. Look at that. It matches the pH, so it'll help you memorize. 35, 35, 45, 45. So as you guys see, it matches, so that can help you in memorizing, okay? So if you know one, you will automatically know the other one, okay? So when I think of PaCO2, remember matching, you want to think about acid and you want to think about the lungs, okay? So PaCO2 is the amount of carbon dioxide in the blood. So without going too much into pathophysiology, because I don't want to confuse you all, but why do I want you guys to match acid and lung to PaCO2? Because I want you guys to remember, the more PaCO2 somebody has, the more acid that they're retaining, the more carbon dioxide that they are retaining in their lungs, okay? So the higher this number, the more acidic the person is. Because remember, PaCO2 match with acid. So the more PaCO2 this person have, the more acid they are, the more acidic they are. And the less PaCO2, the more alkaline, the more basic they are. Because the opposite of acid is base, right? Or alkaline. So that is the case. So just a quick synopsis of how this presents itself in respiratory illness to make it a little bit easier. I'm not going to go too deep into pathophysiology, but we know that if a patient has emphysema or asthma or any kind of COPD, the patient will not be able to breathe right? So right now, I'm breathing normally, but if a patient has asthma, they're not breathing right. So they may not be even able to take a deep breath, right? So when a patient has a respiratory illness, they are retaining or keeping in a lot of acid, a lot of carbon dioxide, because we breathe out. Normal healthy adults and children breathe out carbon dioxide. So if a patient has a respiratory illness, they will retain, they will keep that carbon dioxide. And that carbon dioxide, without getting too much into biochemistry, and that carbon dioxide makes the patient more acidic, okay? Our next value is bicarbonate, okay? So that is HCO3, okay? So we're gonna match that with, I'm gonna match that with basic. So when you see HCO3, one thing basic, and that has to do with the kidneys, okay? So when you're solving your ABGs, you want to remember that when you see HCO3, you're gonna match that with basic and the kidneys, okay? So when you see salt, think pepper. When you see rice, think beans. When you see HCO3, think basic, think kidneys. PaCO2, think acid, think lungs. All right, so we're gonna see HCO3, we're gonna see basic and kidneys, okay? The values for HCO3 is going to be 22 to 26, okay? So the more HCO3 you have in your blood makes you more basic or alkaline. The less HCO3 you have in your blood makes you more acidic, okay? So it's just basically the reverse, all right? So before we move on, I'm going going to do a brief overview of what we just did. And remember guys, repetition equals memory, okay? So if I'm repeating it, I just want you to remember it and you to know it in your head, because this is gonna help you solve if this is respiratory acidosis, metabolic acidosis / alkalosis, whether it's compensated or uncompensated. If this sounds like a whole bunch of mumbo jumbo, don't worry, it's gonna make sense to you real soon, okay? So all you have to do is pay attention. So remember, ABGs, the normal pH value is 7.35 to 7.45. If a patient's blood is less than 7.35, then their blood is more acidic. If it's more than 7.45, their blood is more alkalytic or alkaline. PaCO2, okay? That is carbon dioxide, okay? And when I say PaCO2, I'm gonna automatically match it with acid and lung, even if I forget it, because I've been up all night studying for my anatomy, because I'm taking anatomy along with med-surg, doesn't matter. I know I'm matching PaCO2 with acid and the lung, so I know the more PaCO2 I have, because it matches with acid, is the more acidic the patient is, okay? So if any number above 45, they are abnormally acid. They have too much carbon dioxide in the blood, okay? And if it's less than 35, they don't have enough acid in the blood. They don't have enough carbon dioxide, so they're gonna be like more basic. HCO3, I already match it. I'm doing the matching game. I know it's matches with basic and the kidneys, so higher than 26, I know the patient is more basic or alkaline. Less than 22 is more acid, okay? So we got that, okay, so I'm gonna erase it. All right guys, so we're gonna test your knowledge. You are the nurse working at the med-surg unit. The outgoing nurse gives you a report. Your patient has a blood pH of 7.20. Does this patient have acidosis or alkalosis? 7.20. I'm gonna give you guys a chance to figure it out. Pause this video. Okay, this patient has acidosis. Yes, you're right. You wanna know why? Because remember, any patient who has a blood pH of below 7.35, they're gonna have acidosis, okay? So a pH below 7.35 is acidosis. And a pH above 7.35.
Sorry guys, I meant to say above 7.45 is going to be alkalosis.
Alkalosis. Okay? Alright guys, so you remember that since the patient's pH is below 7.35, 7.20, they have acidosis. Good job. So let's look at the other pH. Let's say the person's pH is 7.62. Is it acidosis or alkalosis? Is it above
4 or 5? Yes, this patient's blood pH is way above 7.45.
They are experiencing alkalosis, okay? So I think we got the concept here. If it's below 7.35, they're experiencing acidosis.
Above 7.45, alkalosis.
Very simple. If you have any questions about this, comment down below or you can email me. Guys, so now we know if the patient is experiencing acidosis or alkalosis, all right? But how do we know if a patient is experiencing a respiratory problem or a metabolic problem, okay? So look back at your sheet that I told you to write down. Remember when I told you HCO3 is to the kidneys, okay, and it's basic, and PaCO2 is to the lungs and it's acid. So that's what we're going to use. We're going to use that matching to help us solve if it's a respiratory or a metabolic problem. How do we find this out? Is abnormality, okay? So we can know if the patient is experiencing a metabolic or a respiratory problem by looking at the HCO3 and the PaCO2. So you guys wrote down your sheets and you memorized the normal values for HCO3 and PaCO2. So you know that if the HCO3 is abnormal, the patient is undergoing a metabolic problem. If the patient's PaCO2 is abnormal or out of that 35 to 45 range, they are going through a respiratory problem, okay? So let's look at some examples. Let's say the pH is 7.23, all right? And the PaCO2 is 47 and the HCO3 is 24. Okay, so we can solve this one by one. First thing I want you guys to notice is the pH. All right, so the first thing we're going to look at is the pH. So is the patient undergoing acidosis or alkalosis? Well, I know my normal pH value is 7.35 to 7.45. It is below 7.35, so I already know this is something acidosis. So we already know this patient is acidic, okay? So let's look at our PaCO2. Okay, our PaCO2 is 47. What is the normal PaCO2 value? The normal PaCO2 value, as you guys have written on your sheet, right, is the normal PaCO2 value is 35 to 45, okay? So the PaCO2 is above 45. So the patient is acidic, all right? Because the patient is retaining carbon dioxide, so it's above 45. So this is a respiratory problem. Because remember, in our matching game, we said that whenever you see PaCO2, you're gonna think about acid and you're gonna think about the lungs. So you have a case of respiratory, and you're having a case of respiratory acidosis. Respiratory, if I can remember how to spell respiratory acidosis, okay? So with the HCO3, the normal HCO3 is 22 to 26. 24 falls within that normal range, so there's nothing wrong with the patient's HCO3. There's nothing wrong with the kidneys, so it is not a metabolic problem, okay? So very good. So this is our next problem, guys. So look at it. All right, so my first step is to look at the pH level. So I know the normal blood pH is 7.35 to 7.45, okay? So this is above 7.45, so I already know this patient is acidic. He's alkalosis. So I could automatically write down right here alkalosis. So we got to find out if this patient has respiratory alkalosis or metabolic acidosis. And how do we know? Remember, PaCO2, we automatically match it with the lungs. So it's already automatically matched with respiratory. HCO3 is already matched with the kidney, so we already know that's matched with metabolic, okay? So let's look at the PaCO2. What's the normal value for PaCO2? The normal value for PaCO2 is 35 to 45. PaCO2 is 38. Is that within the normal value of 35 to 45? Yes, this is within range. So our PaCO2 is normal, okay? Let's look at the HCO3, okay? Normal HCO3 is 22 to 26. That's not normal. That's out of the 22 to 26 range. So this is abnormal, okay? So we're having so since the HCO3 is abnormal, we are having a metabolic problem. So this is metabolic alkalosis. Yay! So our last step is to know if it is compensated or uncompensated. All right, guys, so before we move on, let's quickly go over what is compensation so that you guys can easily solve if it's compensated or uncompensated. Let me give you an example. If a patient has emphysema or asthma, they are retaining a lot of carbon dioxide, right? Or like we like to say it, PaCO2. So they have a lot of carbon dioxide they have a lot of carbon dioxide retained within their lungs, they have something called respiratory acidosis. So our body is so amazing, because if our body sees that there's something wrong with one part of our body, it will try to compensate with the other, okay? Just a quick example, if you're cross-eyed, if you were born cross-eyed like me, the doctor would put a patch on over the left eye to make the right eye stronger, okay? So if the patch is over the left eye, it will make the right eye work harder, because the right eye is like, okay, the left eye is not seeing right now, so the right eye has to work harder. So that's an example of compensation, okay? So if the body senses that there's something wrong with the respiratory, there's something wrong with the lungs, guess what? The kidneys will take over in trying to compensate for what's wrong with the lungs, okay? So if a patient has respiratory acidosis, something is wrong with the PaCO2, okay? So if something is wrong with the lungs, the kidneys will try to compensate and try to create more basic, more alkaline, okay? It will try to make the environment of the blood more alkaline. So you're going to see an increase of the HCO3, okay? I hope this makes sense. If there's something wrong with the patient's lungs and the patient is retaining a lot of PaCO2, and we already did our match, we already know that PaCO2 means acid. If the patient is very acidic, and we know HCO3 is matched with base, and it means more alkaline, the body will try to compensate and try to fix the problem by increasing the amount of HCO3 that's within the blood, okay? So if a patient has respiratory acidosis, if the body's trying to compensate, the body's going to increase the amount of HCO3 within the blood. So what do I mean? Get an example. All right, guys, so we're going to be using this example to help us understand. Straight off the bat, I'm going to let you know all these values are out of whack, okay? If you wrote down in your sheet of paper, or your eye is really good and you're seeing my little cheat sheet, you already know all these values are out of whack, okay? So let's start by seeing this. So if all these values are out of whack, what is it? So pH is 7.25. Normal pH is 7.35 to 7.45. That means the patient is experiencing acidosis, okay? So we want to know, before we used to say if PaCO2 is wrong, it's automatically the lung, so it's going to be respiratory. But if HCO3 is wrong, something wrong with the kidneys, so it's going to be metabolic. But this time, both of them are off, right? But remember, we did the matching. PaCO2 means it's more acidic, okay? So the more PaCO2, the more acidic the patient is. So this is the cause of the acidosis, because normal PaCO2 is 35 to 45. This number says 52, okay? That is way too much carbon dioxide within the body. That is way too much carbon dioxide that the lungs are retaining and therefore transferring to the blood. So we already know that it is respiratory acidosis. So we already know that is respiratory acidosis. But guess what? The HCO3 is out of whack, okay? Because the normal HCO3 is 22 to 26. So so basically the kidneys are trying to compensate for the lungs not being able to expel the acid out of the body. So the body says, oh wait, hold up, there's too much acid in here, so let me increase the amount of base in the blood. So it's going to increase the amount of HCO3 in the blood. So there is compensation going on, okay? But we want to know if this is full compensation or partial compensation. And the way to know this is full compensation or partial compensation is to look at the pH, okay? So the pH is still abnormal, so the body wasn't able to fully compensate in order to get the pH back up to that normal level. So this is going to be respiratory acidosis, partial compensation. Let's go to our next example. In this next example, we have a pH of 7.53, okay? Normal pH is 7.35 to 7.45. So 7.53 is more than 7.45, so we are dealing with some type of alkalosis. Okay, so let's look if it is something wrong with the kidneys or something wrong with the lungs, okay? PaCO2, we already know, we match that with lungs, we match that with acidic. It is 47, okay? Normal PaCO2 is 35 to 45. Oh, this is out of whack now, okay? Because this is 47, okay? But what does this tell me? This tells me that there's too much PaCO2 in the body. There's too much acid in the body. But this patient, because we already saw from the pH value, this patient is having an alkalosis problem, not an acidosis problem. So even though the patient has too much acid, it's not a respiratory problem. So let's find out what kind of problem it is. Our HCO3 is 38, okay? But normal HCO3 is 22 to 26. This HCO3, remember, HCO3, we match it with basic and we match it with the kidneys, all right? So the more HCO3 we have, the more basic our body is, or the more alkaline our body is. So we already know that there's way too much HCO3. This is a metabolic
alkalosis.
Okay, good job. And is this metabolic
alkalosis?
Is it compensated or uncompensated? It is compensated because the PaCO2 is out of whack. So it is compensated. And our next question will be, is it a partial compensation or is it a full compensation? Now, we look at the pH to tell us that. If the pH is within the normal value, it is going to be a full compensation. If it's not, it is a partial. So it's out of whack because it's not within the pH 7.35 to 7.45 range. So it is going to be a partial compensation because the pH is not to it didn't go back to its normal value. Okay, so it is partial compensation. All right, guys, so let's look at the trickiest of them all. All right, so your patient's pH is 7.42, okay? So does that fall between the 7.35 and the 7.45 range? Yes, it does. So this is normal, all right? So is there something wrong with the patient? Is there nothing wrong with the patient? All right, let's look at the PaCO2. So normal PaCO2 is 35 to 45. Patient's PaCO2 is 48. Now that is abnormal, okay? So something is maybe wrong with the lungs, okay? Because PaCO2, remember we matched it with acid and lung. The patient has too much acid in there. HCO3, we matched it with the kidneys, basic. It's 33. Normal HCO3 is 22 to 26. So something is wrong with the kidneys. It's a metabolic problem too. So which one is it? HCO3 is 33, okay? So there's too much base in the body too. Something is wrong with the kidneys, okay? So there's too much base and there's too much acid, but the pH is normal? Huh? How do you solve this? Okay, don't worry, have no fear, Kimmy's here. I know, it's so corny. So this is how we solve it, okay? So even though the pH is normal, there's something going on here, and the body is fully compensating for it, okay? So basically, The way to figure out is if your professor gives you the patient's diagnosis, that's the easiest way to find out if it's a metabolic problem or an acidic problem, okay? So for example, if your patient comes in with an asthma attack, okay, or an exacerbation of emphysema, we already know that you may be saying, oh, okay, that is why the patient is retaining all of that carbon dioxide, because the patient can't breathe right. And because the blood is so acidic, the kidneys are trying to, you know, retain as much HCO3, which is the base, to combat that acidic blood caused by the increased PaCO2, okay? So that's an example. If your professor gives you a diagnosis, you'll be able to figure it out that way, okay? But let's say, you know, your professor doesn't give you a diagnosis, he just gives you those numbers, and you're supposed to figure out whether it's acidosis. You're supposed to figure out what's going on, because even though the pH is normal, the PaCO2 and the HCO3 is off, so there's obviously something wrong. When you have a problem like this, there's something called a normal acidic side and a normal alkaline side, okay? So simple, you don't have to memorize it or anything. I like to think of it like this. A little thing to remember is, well, pick your side, you know? The pH is normal, but the PaCO2 is abnormal, and the HCO3 is abnormal as well. It's like, come on, patient's body, pick your side. If a patient's blood tends to be numbers like the 3s, 7.35, 7.36, 7.37, 7.38, 7.39, as long as you see the 3s in it within the normal 7.35, 7.45, as long as you say the normal 3s, the patient's blood is more acidic than alkaline, okay? But however, if you see the 4s, like 7.41, 7.42, 7.43, the more basics the patient's blood is, okay? So I want to reiterate this again. These values are still normal. They still fall between the 7.35 and 7.45 normal range. The only difference is when you see the 3s, you know the patient's blood is more acidic, but normal acidic. And if you see the blues, the 4s, the patient's blood is more alkaline, even though it's normal, okay? Now that you got this concept, I'm going to erase that part so we can go back to the problem, okay? So write down this concept here, and I will erase. Since it has a 4 in it, they're choosing the basic side, all right? So the patient has something, alkalosis. So what's gonna make the body more alkalosis? More PaCO2, and we already said that we matched PaCO2 with being acidic, or more HCO3. We already matched HCO3 with being basic and metabolic. It's gonna be more HCO3, okay? So it is metabolic alkalosis. The PaCO2 is out of whack, but that's gonna make the patient more acidic. But there's more HCO3, that's gonna make the patient more basic. Metabolic alkalosis. So is this patient is there compensation going on? Yes, of course there's compensation going on, okay? How do we know this? Because the PaCO2 is out of whack. So there is compensation. Is the compensation full or partial compensation? Okay, so we do this by looking at the pH value. So is the pH between 7.35 and 7.45? Yes, it is. It's within the normal pH value. So yes, it is gonna be full compensation. All right, let's do one last problem. pH is 7.37. It is normal. Yes, it is. Because normal pH is what? 7.35 to 7.45. PaCO2, normal PaCO2 is 35 to 45. 52, that is way out of whack. That is way too much carbon dioxide. And PaCO2, we already match it with acid in lungs. There's a lot of acid going on there, okay? HCO3 is 28, okay? Normal HCO3, we match that with basic and metabolic, the kidneys. Normal HCO3 is 22 to 26. 28 is way out of bounds, okay? Too much basic, okay? So pH is fine, PaCO2 out of whack, too much PaCO, too much acid, too much base. So what is it? We're gonna pick your side game. Pick your side, okay? So we see the number 3 is in the 3s, right? So is that gonna be in the acidic side or the basic side? Like we said before, if you see the number 3, we are gonna be in the acidic side, okay? So it's something acidosis. So using our matching technique, is it going to be respiratory acidosis or metabolic acidosis? Well, let's look at what's going wrong. PaCO2, we match that with acid. The more PaCO2 we have, the more acidic the body is, okay? So if the PaCO2 is 52, way too much acid in there. But wait, there's too much HCO3. But remember, the more HCO3 we have, the more basic the body is, 28. So it's not going to be metabolic acidosis. It's going to be respiratory acidosis because there's way too much PaCO2 in there. Respiratory acidosis. And is it compensated? Yes, it is, because the kidneys, this HCO3 number is out of whack. That means the kidneys is trying to fix what the lungs cannot do. So we're gonna put compensation. Is it full compensation or partial compensation? Well, we'll look at the pH. Is the pH within normal range? Yes, it is. So it's going to be full compensation. Okay. All right, guys, so we have reached the end of our practice with ABGs, but not your practice with ABGs. I found this great website online where you guys can log in and practice your ABGs. I will leave the link to this website down in the description box below. If you guys still need more help from me, feel free to contact me at KimmyDTV@gmail.com, or you can also reach me on Instagram at KimmyDTV so that we can further explain it to you, okay? So guys, thank you guys so much for watching. I really appreciate this video. Let me know if you got to the end of this video. Let me know how I can improve this for you. Did you get it? Did you not get it? What did you like about it? What didn't you like about it? And I'll see you guys on the next one. Bye! Happy calculating ABGs!